Do you know the signs of prostate cancer? It's a question worth pondering. Prostate cancer, one of the most common types of cancer in men, often goes unnoticed until it's in its advanced stages. The reason? Its signs can be subtle and easily mistaken for other conditions. That's why understanding these signs is crucial to early detection and successful treatment. Let's dive into sign 15, persistent lower back pain. Now, this isn't your everyday backache from lifting something heavy or sleeping in an awkward position. This is a consistent, nagging pain that doesn't seem to go away, regardless of what you do to alleviate it. It's a pain that's deep, sometimes radiating, and often unresponsive to typical pain relievers. While there are many causes of lower back pain, persistent pain in this area might be a sign of prostate cancer. Persistent lower back pain could be a sign of something more serious. It could be the earliest sign of prostate cancer. Moving on to sign 14, difficulty in urination. You might wonder, what does this have to do with prostate cancer? Well, the prostate gland surrounds the urethra, which carries urine from the bladder out of the body. If the prostate becomes enlarged, which can happen with cancer, it can press on the urethra and cause difficulty in urination. Now let's delve into sign 13, frequent urination, especially at night. This is due to the same mechanics as the previous sign. When the prostate enlarges, it presses against the bladder, causing it to feel full more often. This can lead to frequent trips to the bathroom. Interestingly, these two signs may seem contradictory, difficulty in urination and frequent urination. But they're two sides of the same coin, linked by the common factor of an enlarged prostate. If you find yourself frequently running to the bathroom, especially at night, it could be more than just a small bladder. Now let's delve into sign 12, blood in urine or semen. This could be a telltale sign of prostate cancer. The presence of blood in these bodily fluids is often due to the growth of cancerous cells in the prostate, which can lead to bleeding. However, blood in urine or semen can also be caused by other conditions, so it's essential to seek medical advice if you notice this change. Moving on to sign 11, erectile dysfunction. The prostate gland plays a vital role in sexual health, and prostate cancer can interrupt its normal functioning. This disruption can result in erectile dysfunction, making it another potential sign of this disease. Finally, let's touch on sign 10, painful ejaculation. This discomfort could result from the pressure created by a tumor on the prostate, interrupting the usual process of ejaculation. Experiencing any of these signs? It's time to consult a healthcare professional. Sign 9 is one not to ignore, unexplained weight loss. This could be due to the body battling the cancer, or it might be a side effect of the cancer itself. Remember, the key word here is unexplained. If you're not trying to lose weight and it's happening anyway, it's worth discussing with your doctor. Moving on to sign 8, bone pain. Prostate cancer can spread to the bones, causing discomfort or pain in the hips, spine, or thighs. It's not your everyday muscle pain we're talking about here, but a persistent ache that doesn't go away. Finally, for this segment, we come to sign 7, loss of appetite and nausea. These symptoms might be related to many health issues, but when combined with other signs we've discussed, they could point to prostate cancer. It's important not to dismiss these symptoms as just another stomach bug. These signs might seem common, but they could be indicating a much graver issue. Sign 6 might surprise you. Swelling in the legs or pelvic area. This could be caused by a problem in the lymphatic system, a network of vessels and glands that help fight infection and disease. Prostate cancer can interfere with this system, leading to fluid buildup and subsequent swelling. Next up is sign 5, weak or interrupted urine flow. This happens when the tumor in the prostate is large enough to start pressing against the urethra, the tube that carries urine out of your body. As the tumor grows, it can obstruct the urethra, resulting in a weaker or interrupted flow. Finally, sign 4, difficulty starting or stopping a stream of urine. This is related to the same pressure exerted on the urethra. The tumor can make it hard to control the muscles that help you start and stop urinating. Remember, early detection is key in fighting prostate cancer. We're down to the last 3 signs. Sign 3, pain or burning during urination. This discomfort could be an indication of prostate cancer. The tumor, growing in the prostate, can press against the urethra, causing a painful or burning sensation during urination. It's essential to note that this symptom is also common in other conditions like urinary tract infections. Moving to sign 2, discomfort when sitting. This might seem unusual, but as the prostate gland is located at the base of the bladder, a tumor can cause discomfort in this area, especially when sitting, due to the increased pressure. Lastly, sign 1. A sense of not being able to empty the bladder. This is because a tumor in the prostate can impede the flow of urine. You may feel like you still need to urinate, even after you've just been. And there you have it, the 15 signs of prostate cancer. Knowing these signs could save a life. We've journeyed together through a list of 15 signs of prostate cancer, each one significant and worth paying attention to. Let's take a moment to recap this vital information. We began with the 15th sign, a persistent need to urinate, particularly at night. From there, we moved to difficulty starting and stopping urination, and then to painful or burning sensations while urinating, all signs that should not be ignored. We discussed the 12th to 10th signs, which included blood in urine or semen, erectile dysfunction, and discomfort in the pelvic area. These are symptoms that might be easy to overlook or attribute to other conditions, but remember, they could be indicative of something far more serious. Signs 9 to 7 highlighted the importance of recognizing changes in our bodies, decreased force in the stream of urine, bone pain, and unexplained weight loss. Changes like these can be subtle, but they are often our body's ways of telling us that something isn't right. The final 6 signs brought us to the more aggressive symptoms: loss of bladder or bowel control, numbness or pain in the hips, thighs, or lower back, and frequent pain or stiffness in the lower back, hips, or upper thighs. Each of these 15 signs is a potential red flag that should not be taken lightly. Regular checkups and early detection are our most effective tools in the fight against prostate cancer. It's vital to have open conversations with your healthcare provider about any concerns or symptoms you may be experiencing. Your health is a precious gift, and being well informed is one of the best ways to protect it. Stay vigilant, stay proactive, and most importantly, stay healthy. If you found this information helpful, subscribe to our channel for more informative content. Remember, your health is in your hands. Stay informed, stay healthy,